Hey, what up? Here we are. We're talking Chapter 9, the urinary system. Let's get started. In our overview section here, we have major structures, the kidneys, with the word part nephra, nephro, or reno. Primary functions are to filter the blood, to remove waste products, maintain electrolyte concentrations, and remove excess water to maintain the fluid volume within the body. Electrolytes are what I crave. We got renal pelvis with the word root pyelo, collects urine produced by the kidneys. We have urine with the word root part urea as a suffix. We have urino as our word root, which is liquid waste product to be excreted. We have the ureters with the word root ureter-o, transports the urine to the kidneys from the kidneys to the bladder. And we have urinary bladder, cysto, and vesico, that stores urine until it's excreted. Finally, we have the urethra with the word root urethro, transports urine from the bladder through the urethral meatus where it's excreted from the body. We also have all of your keyword parts, key medical terms. Might want to make some flashcards out of those. The urinary system performs many functions that are important in maintaining homeostasis, a state of equilibrium that produces a constant internal environment throughout the body. To achieve this, the urinary system maintains the proper balance of water, salts, and acids in the body fluids by removing excess fluids from the body or reabsorbing water as needed, constantly filtering the blood to remove urea and other waste materials from the bloodstream. Urea is a major waste product of protein metabolism. It also converts these waste products and excess fluids into urine in the kidneys and excretes them from the body via the urinary bladder. The urinary system consists of 2 kidneys, 2 ureters, 1 bladder, and a urethra. The adrenal glands, which are a part of the endocrine system, are located on top of the kidneys. The kidneys constantly filter the blood to remove waste products and excess water. These are excreted as urine, which is 95% water and 5% other wastes. The 2 kidneys are located retroperitoneally, with one on each side of the vertebral column below the diaphragm. Retroperitoneally means located behind the peritoneum, which is the membrane that lines the abdominal cavity. Each kidney consists of 2 layers that surround the renal pelvis. Renal means pertaining to the kidneys. The renal cortex is the outer layer of the kidney. It contains over 1 million microscopic units called nephrons. The medulla is the inner layer, and it contains most of the urine collecting tubules. A tubule is a small tube. Nephrons are the functional units of kidneys. They form urine by the process of filtration, reabsorption, and secretion. Each nephron contains a glomerulus, which is a cluster of capillaries surrounded by a membrane called the Bowman's capsule. Blood flows into the kidney through the renal artery. It is filtered in the capillaries of the glomerulus and leaves the kidney through the renal vein. Waste products pass through a series of urine-collecting tubules and are transported to the renal pelvis before entering the ureters. Urochrome is the pigment that gives urine its normal yellow, amber, or straw color. The color of urine can be influenced by normal factors such as the amount of liquid consumed or by diseases and medications. The ureters are narrow tubes, each about 10 to 12 inches long. Each ureter carries urine from the kidney to the urinary bladder. The urinary bladder is a hollow muscular organ that is a reservoir for urine. It is located in the anterior portion of the pelvic cavity behind the pubic symphysis and stores about 1 pint of urine. In a pregnant woman, the uterus rests on the bladder, and this pressure may decrease its capacity. The urethra is the tube extending from the bladder to the outside of the body. Be careful because the spellings of ureter and urethra are very similar. 2 urinary sphincters, one located at either end of the urethra, control the flow of urine from the bladder into the urethra and out of the urethra through the urethral meatus. A sphincter is a ring-like muscle that closes a passageway. The urethral meatus, also known as the urinary meatus, is the external opening of the urethra. The female urethra is approximately 1.5 inches long. The urethral meatus is located between the clitoris and the opening of the vagina. In the female, the urethra conveys only urine. The male urethra is approximately 8 inches long, and the urethral meatus is located at the tip of the penis. In the male, the urethra conveys both urine and semen. The neck of the urethra is surrounded by the prostate gland, which is part of the reproductive system, and we'll discuss that further. As the bladder fills up, pressure is placed on the base of the urethra, resulting in the urge to urinate or micturate. Urination, also known as micturation or voiding, is the natural process of excreting urine. Urine requires the coordinated contraction of bladder muscles and relaxation of the sphincters. This action forces the urine through the urethra and out through the urinary meatus. Now let's check out some medical specialties related to the urinary system. We have a nephrologist who specializes in diagnosing and treating diseases and disorders of the kidneys, and a urologist, which specializes in diagnosing and treating diseases and disorders of the urinary system of females and the genitourinary system of males. Now we'll look at everything that can go wrong in the pathology of the urinary system. Renal failure, also known as kidney failure, is the inability of the kidney or kidneys to perform their functions. The body cannot replace damaged nephrons. When too many nephrons have been destroyed, the result is kidney failure. Anuria is also known as anuresis, is the complete suppression of urine formation by the kidneys. Uremia, also known as uremic poisoning, is a toxic condition caused by excessive amount of urea and other waste products in the bloodstream. Acute renal failure has sudden onset characterized by uremia. ARF may be caused by many factors, including a drop in blood volume or blood pressure due to an injury or surgery. Chronic renal failure is a progressive disease that may be caused by a variety of conditions. When kidney function is insufficient, dialysis or transplantation is required. End-stage renal disease refers to the late stages of chronic renal failure. Nephrotic syndrome is a general group of kidney diseases. The following are characteristics of kidney malfunction diseases: edema, which is excessive fluid in the body tissue; hyperproteinuria, abnormally high concentrations of protein in the urine; hypoproteinemia, abnormally low concentrations of protein in the blood; hyperlipidemia, abnormally large amount of lipids in the blood. Nephrosis and nephropathy both mean diseases of the kidney, and these terms are used interchangeably with nephrotic syndrome. Diabetic nephropathy is a result of the damage to the kidney's capillary blood vessels that is caused by long-term diabetes mellitus. Glomerulonephritis is an inflammation of the kidney involving primarily the glomeruli. In acute glomerulonephritis, the urine is dark brown or black. This condition is often related to an autoimmune problem. Hydronephrosis is the dilation or enlargement of the renal pelvis of one or both kidneys. This is the result of an obstruction of the flow of urine. Nephrectasis is the distension of a kidney. Distension means the state of being enlarged. Nephritis is the inflammation of the kidney. Nephroptosis, also known as floating kidney, is the downward displacement of the kidney. Nephropyosis is the suppuration of the kidney. Suppuration means the formation or discharge of pus. Pyelitis is an inflammation of the renal pelvis. Pyelonephritis is an inflammation of the renal pelvis and of the kidney. Renal colic is an acute pain in the kidney area that is caused by blockage during the passage of a kidney stone. A stone, also known as calculus, is an abnormal mineral deposit. These stones vary in size from very small sand-like granules to the size of marbles and are named for the organ or tissue where they are located. Nephrolithiasis is a disorder characterized by the presence of stones in the kidney. Hydroureter is the distension or stretching out of the ureter with urine that cannot flow because the ureter is blocked. Ureterectasis is the distension of a ureter. Ureteroragia is the discharge of blood from the ureter. Ureterostenosis is a stricture of the ureter. A stricture is an abnormal band of tissue narrowing a body passage. Cystalgia or cystodynia both mean pain in the urinary bladder. Cystitis is an inflammation of the bladder. Interstitial cystitis is an inflammation within the wall of the bladder. This is a chronic condition with symptoms similar to those of cystitis. A cystocele is a hernia of the bladder through the vaginal wall. Cystorasia is bleeding from the bladder. Urinary tract infections usually begin in the bladder. These infections occur more frequently in women because of the shortness of the urethra and the proximity of its opening to the vagina and rectum. A vesicovaginal fissure is an abnormal opening between the bladder and vagina. Blockage of the urethra can cause urine to back up into the ureters. This condition, which is called reflux, can eventually result in damage to the kidneys. Urethral is the pain in the urethra. Urethritis is an inflammation of the urethra. Urethrorasia is bleeding from the urethra. Urethrorea is an abnormal discharge from the urethra. Erythrostenosis is the stricture or stenosis of the urethra. Abnormal urethral openings include epispadias. In the male is a congenital abnormality in which the urethral opening is located on the dorsal side of the penis. In the female with epispadias, the urethral opening is in the region of the clitoris. Hypospadias in the male is a congenital abnormality in which the urethral opening is on the undersurface of the penis. In the female with hypospadias, the urethral opening is into the vagina. Paraspadias is a congenital abnormality in males in which the urethral opening is on one side of the penis. Diuresis is the increased excretion of urine. Dysuria is difficult or painful urination. This condition is frequently associated with urinary tract infections. Enuresis is the involuntary discharge of urine. Nocturnal enuresis, which occurs during sleep, is also known as bedwetting. Nocturia is excessive urination during the evening or nighttime. Oliguria means scanty urination. Polyuria is excessive urination, and urinary retention is the inability to void or empty the bladder. Incontinence means the inability to control excretory functions. Urinary incontinence is the inability to control the voiding of urine. Urinary stress incontinence is the inability to control the voiding of urine under physical stress, such as running, sneezing, laughing, or coughing. Urge incontinence is when urination occurs involuntarily as soon as an urgent desire to urinate is felt. This urge may be triggered by a physical movement rather than by a full bladder. Catheterization is the insertion of a sterile catheter through the urethra and into the urinary bladder. This is most commonly performed to withdraw urine, relieve urinary retention pressures, or prevent incontinence during surgical procedures. A catheter may also be used to place fluid, such as a chemotherapy solution, into the bladder. Cystoscopy or cystoscopy, which is also known as cysto, is the visual examination of the urinary bladder using a cystoscope. A cystoscope is also used for treatment procedures such as the removal of tumors. An intravenous pyelogram is a radiographic study of the kidneys and ureters in which iodine is injected into a vein as a contrast medium to define these structures more clearly. A cub, kidneys, ureters, and bladder, is a radiographic study of these structures without the use of a contrast medium. This study is also referred to as a flat plate of the abdomen. Intravenous urography is the radiographic visualization of the urinary tract with the use of contrast medium. The resulting record is called a urogram. Excretory urography is so named because it traces the action of the kidney and it processes and excretes dye injected into the bloodstream. Retrograde urography is a radiograph of the urinary system taken after a dye has been placed in the urethra through a sterile catheter and caused to flow upward or backward through the urinary tract. Cystography is a radiographic examination of the bladder after installation of a contrast medium via a urethral catheter. The resulting film is called a cystogram. Voiding cystourethrogram, VCUG, may be performed after cystography. In this diagnostic procedure, a fluoroscope is used to examine the flow of urine from the bladder and through the urethra. Urinalysis is the examination of urine to determine the presence of abnormal elements. Now that we know what gets us sick, let's see how we can fix it in the treatment procedures of the urinary system. Diuretics are medications administered to increase urine secretion to rid the body of excess sodium and water. Dialysis is a procedure to remove waste products from the blood of patients whose kidneys no longer function. The two types of dialysis in common use are hemodialysis and peritoneal dialysis. Hemodialysis filters waste products from the patient's blood. A shunt implanted in the patient's arm is connected to the artificial kidney machine, and arterial blood flows through the filters. The filters contain dialysate, a solution made up of water and electrolytes, which removes excess fluids and waste from the blood. After these are removed, the blood is returned to the body through a vein. In peritoneal dialysis, the lining of the peritoneal cavity acts as the filter to remove waste from the blood. Dialysate solution is run into the peritoneal cavity, and the fluid is exchanged through a catheter implanted in the abdominal wall. This type of dialysis is used for renal failure and certain types of poisoning. Continuous ambulatory peritoneal dialysis provides ongoing dialysis as a patient goes about his daily activities. In this procedure, a dialysate solution is instilled from a plastic container worn under the patient's clothing. Every 6 to 8 hours, the used solution is drained back into this bag and the bag is discarded. A new bag is then attached, the solution is instilled, and the process continues. Continuous cycling peritoneal dialysis uses a machine to cycle the dialysate fluid during the night while the patient sleeps. A renal transplantation, also known as a kidney transplant, is the grafting of a donor kidney into the body to replace the recipient's failed kidneys. Nephrolysis is the freeing of a kidney from adhesions. An adhesion is a band of fibers that hold structures together abnormally. The suffix lysis means setting free, however, it also means destruction. Therefore, the term nephrolysis can also describe a pathologic condition in which there is the destruction of kidney substance. Nephropexy is a surgical fixation of a floating kidney. A nephrostomy is the establishment of an opening between the pelvis of the kidney through its cortex to the exterior of the body. Pyeloplasty is the surgical repair of the renal pelvis. And a pyelotomy is a surgical incision into the renal pelvis. Lithotripsy, also known as extracorporeal shockwave lithotripsy, or ESWL, is the destruction of a kidney stone with the use of ultrasonic waves traveling through water. Extracorporeal means situated or occurring outside the body. A nephrolithotomy is the surgical removal of a kidney stone through an incision in the kidney. A ureterectomy is the surgical removal of a ureter. Ureteroplasty is the surgical repair of a ureter. Ureterography is the suturing of a ureter. A cystectomy is the surgical removal of all or part of the urinary bladder. Cystopexy is the surgical fixation of the bladder to the abdominal wall. Cystography means suturing of the bladder. A lithotomy is a surgical incision for the removal of a stone, usually from the bladder. The term also is used to describe a physical examination position, as discussed later. A suprapubic catheter is an indwelling catheter placed into the bladder through a small incision made through the abdominal wall just above the pubic bone. Indwelling means something that remains inside the body for a prolonged time. A meatotomy is an incision of the urinary meatus to enlarge the opening. Urethropexy is a surgical fixation of a urethra, usually for the correction of urinary stress incontinence. Urethroplasty is a surgical repair of the urethra. A ureterostomy is the surgical creation of a permanent opening between the urethra and the skin. A urethrotomy is a surgical incision into the urethra for relief of stricture. Don't forget to check out some of these career opportunities. In addition to the medical specialties already discussed, some other health occupations involving treatment of the urinary system include dialysis technician, who operates the hemodialysis machine and also provides emotional support and nutritional counseling for dialysis patients, or a urology nephrology licensed practitioner nurse or a certified nursing assistant. They provide care and information to patients with urinary and kidney problems. Also, make sure you check out the health occupation profile of the urologist. And make sure you check out this quote from Joseph Edward Murray. He was one of the leading doctors on the team who successfully completed the first kidney transplant. I know that this lecture was helpful, but by all means, make sure you bring all of your questions to class. And until next time, thank you so much. Be good people, do good things, and we'll see you next time. Bye-bye.